Welcome back, everyone. Today we're talking about seborrheic dermatitis, also known as dandruff. As always, this is for informational purposes only, not medical advice. Thank you. Welcome back, everyone. Today we'll be discussing seborrheic dermatitis, also known as dandruff, seborrheic eczema, and SIBO psoriasis. It affects millions of people worldwide and is one of the most common things I see in my practice day to day. It's characterized by red scaly patches and plaques along the scalp, the face, and sometimes the upper torso. It's not contagious, it's not life-threatening, but it can be very persistent, chronic, bothersome, and lead to significant social or self-esteem problems. It can also be very itchy and bothersome symptomatically. This presentation will explore the potential causes, the triggers, and relationships between seborrheic dermatitis and our internal health, other conditions, and our environment. So we don't know exactly why seborrheic dermatitis happens, but we think it's a relationship between our skin and the Malassezia yeast that lives on it. So overgrowth of this Malassezia can naturally trigger an inflammatory response, leading to symptoms of seborrheic dermatitis. I.e., this is one reason why antifungals like ketoconazole shampoo are used to treat seborrheic dermatitis. Excess sebum. Increased sebum production leads to an environment conducive to yeast growth, exacerbating the conditions and inflammation. Immune dysfunction. A weakened or dysregulated immune system may play a role in the development of seborrheic dermatitis, and we'll talk about that a little bit later. And then genetic factor. Some people are just genetically predisposed to get this condition. It runs in families, and they're more susceptible to this condition, similar to many other conditions like psoriasis, vitiligo, among other things. So, there are two main types of seborrheic dermatitis that we think about: infantile, which we won't really touch on, cradle cap is the other word for it, and this typically resolves without treatment. And then adult seborrheic dermatitis, which is what we see many times every day in our clinics. So, common triggers of seborrheic dermatitis. Now, this isn't always the case, and sometimes there aren't triggers, but common triggers include stress, emotional or physical stress, hormonal changes, particularly in female patients, weather conditions. For example, where I'm based, the winters become very dry, and I often see flares or worsening of people's seborrhea during the winter. And then harsh chemicals. Irritants found in our skincare, shampoos, products can aggravate the skin and potentially worsen our seborrhea. So, clinical features of seborrhea. You're going to find these ill-defined erythematous, which means red, scaly plaques and patches, typically along the scalp, behind the ears, the eyebrows, nasolabial fold, in men along the beard area, and if it's really severe, it can travel even down to the central chest and upper back. So, the relationship between nutrition and seborrheic dermatitis. Now, this is a very brief overview. If you're interested in the studies behind this, just go to my website very quickly. You'll see a seborrheic dermatitis category. You can scroll down and actually see the studies behind this data. So, high fruit intake, in general, high whole food intake has been shown to improve seborrheic dermatitis in some patients. We also know that Western diets, such as the SAD American diet, can lead to increased inflammation and subsequently increased risk of seborrhea. The link between weight and seborrheic dermatitis is not so clear-cut. It may be related to the aforementioned Western diet. It may be related to the weight itself and the increased inflammatory cytokines that are found in adipose tissue. This would be similar to how we think about potentially psoriasis and the studies that show that some weight loss can improve psoriasis symptoms. That may also hold for seborrheic dermatitis, given there's a tight relationship between the two. And then very rarely, particularly if patients aren't eating enough or if they have a limited diet, a deficiency in things like zinc and certain vitamins can lead to or worsen their seborrheic dermatitis. The impact of environmental factors. So climate, low humidity, as we mentioned. We know pollution can affect all components of our skin. We know that there's a relationship between when wildfires occur and then flares of eczema. So the same is true for seborrheic dermatitis. And then UV index or sunlight. Some people think in the wintertime, the lack of sunlight worsens their seborrhea. Some people think in the summertime, their increased sunlight improves their seborrhea, all within balance and all without drying or irritating the skin. And then skin disorders, most commonly psoriasis and seborrhea have a relationship where sometimes patients present with something like SIBO psoriasis, where it has the morphology and distribution of seborrhea, but the severity of psoriasis. Acne and rosacea we think about in a different category, but there are some patients that have this seborrhea rosacea overlap where it's not entirely clear and it doesn't fit one picture or another, but rather an overlap between the two. Remember, seborrhea's relationship between our skin and the microbiome, the Malassezia, and rosacea, in a very similar way, is thought of as a relationship between our skin and the overlying microbiome. So that overlap makes sense. We see, for some reason, Patients with psychiatric disorders or mental health issues, such as depression, have worsening seborrhea. We don't know exactly why, but there may be a component of how the nerves within the central nervous system and peripheral nervous system that are affected by our mood, our mental health, can also play a role in seborrhea by impacting the nerves and the relationships between the cytokines and neurotransmitters within our skin. Now, that data is not fleshed out, but that is a hypothesis that potentially the nerves, the immune system, can be impacted by our mental health and subsequently lead to worsening seborrhea. We know that patients with HIV or AIDS, even if well controlled, can have worsening of their seborrhea. Again, it's this abnormal, dysfunctional relationship between our immune system and then neurologic disorders, the most common being Parkinson's disease. Patients with Parkinson's disease may have worsening of their seborrhea or have new onset severe seborrhea. And again, we don't know exactly why, but there is some relationship between the nerves, the skin, and the seborrhea. So finally, we know now what seborrhea or dandruff looks like. We know that there's some healthy lifestyle choices that may reduce seborrhea. We know stress management is important. We know that there are various triggers. Everyone is different, but various triggers to avoid that can exacerbate the condition. And then finally, if you can't control the seborrhea with lifestyle management, with avoidance of triggers, with over-the-counter products, it's important to consult with a professional because we treat this every single day and we have various tools and methods to help you navigate this condition. As always, if you thought this was helpful, if you know somebody that might benefit from this, please share it. It helps me out build the channel and it helps me reach people that might benefit from this material. And as always, thank you so much for the support. Bye bye.